Well, thanks so much for having me here today. I'm excited to be here to share some information about 5210 Healthy Choices Count and the work that's going on across the state to promote healthy habits in childhood. Just to give you a little bit of my background, I'm a pediatrician at Blank Pediatric Clinic. I've been there for about 14 years since I graduated from my residency up in Madison, and I'm the immediate past president of the Iowa chapter of the AAP and the founder and chair of the Committee on Obesity for our state chapter. I've had the opportunity to work at the national level with the section on obesity as a coach in their Coaches Network, which is a network of pediatricians working in childhood obesity across the United States. And then most recently, I've had the opportunity to partner with folks in this state on the 5210 healthcare program. So just to give you an overview of the issue, about 2/3 of adults in our state have overweight or obesity, and about 1/3 of our adults have obesity, which is about 13th in the nation. As far as the youth in our state, 1/3 of children ages 10 to 17 have overweight or obesity, and about 15% or so have obesity, and that places us about 21st in the nation. And so this graph came out in the Journal of Pediatrics last month, and it really shows some concerning trends. So in the past, we thought that perhaps we were seeing a leveling off in obesity rates in the toddler population. However, this most recent analysis shows that that was a blip on the radar, and in fact, obesity rates are still increasing. About 17% of girls and 19% of boys in our country have obesity. And then the lower lines actually illustrate severe obesity. So these are kids at the 120th and 140th percent of the 95th percentile of BMI. And so we know that the comorbidities and severe health conditions associated with severe obesity is even higher. And so the trends in the severe obesity categories is increasing as well. And so in 2013, the AMA adopted a policy recognizing obesity as a chronic disease state. It's a complex disease that we are all aware of, and it's mediated by interplay of multiple factors: genetic, biologic, metabolic, and behavioral, as well as social, economic, and cultural determinants. And it's currently the most prevalent chronic disease of childhood. About 12.7 million children are affected with obesity, which is twice the rates of asthma in our country. And so we know that when we're considering obesity and its complexity, it's important to consider the socio-ecological model for child health. And in regard to obesity, we know that there are a number of factors inherent to the child themselves that affect the risk of obesity in that child, but also the family and community surrounding that child play a large role into the likelihood of the development of obesity as well. And so what are the complications of obesity? Many of these conditions we used to only see in adulthood, but now we're seeing them at younger and younger ages. We routinely detect children with elevated lipid levels in our clinics. We're screening kids for liver disease and type 2 diabetes, and are finding prediabetes and diabetes at alarming rates. And we know that the disease course in these conditions is much more aggressive than in adults. We know that children with type 2 diabetes are much more likely to progress to end-stage renal disease than adults affected by the disorder. And in liver disease, non-alcoholic fatty liver disease progresses to end-stage renal disease more and more commonly, and soon will become the most common cause requiring a liver transplant in our country. We know about high blood pressures, the social and self-esteem issues associated with this condition, as well as sleep disturbances and sleep apnea and orthopedic problems. And all of these are being seen in childhood. We know that children and adolescents with obesity, about 70 to 80% of those children will go on to have overweight or obesity as adults. So this is a condition that has its roots in childhood and is likely to persist into adulthood. And we know that the three leading causes of death in adults are strongly associated with obesity as well. And so we know that there's many health consequences, but there are also economic costs associated with this condition. About $190 billion is the estimated annual cost of obesity-related illnesses, and that's about 21% of the annual medical spending. And if the 12.7 million U.S. children and adolescents with obesity progress on to adulthood with obesity, the average individual cost will be about $92,000 per individual. And the lifetime societal cost will reach $1 trillion of these dollars. So what can we do about this issue? Many of you are probably familiar with the 5210 message, but let me just take a minute to kind of go through the scientific evidence behind that message. So what is 5210? It's a common evidence-based message to promote healthy eating and active living. It's utilized across the country and has been utilized in various places across the state, but not necessarily in such an organized manner as is currently occurring. It's a simple message backed by scientific evidence and endorsed by multiple associations. So the Academy of Pediatrics as well as Head Start has already endorsed this message for many years, and so it's been utilized in many places. And it ties together multiple messages that families and patients see across communities and can strengthen the work that all of these individual messages have. So the 5 stands for 5 or more fruits and vegetables daily. 2 stands for 2 hours or less of recreational screen time. 1 is the recommendation to have 1 hour or more physical activity, and 0 sugary drinks. Drinking more water is the recommendation. And so what's the evidence behind each of these? We know that the 5 fruits and vegetables daily provide vitamins and minerals, and that's important for our growth and development. And it's been linked to lower rates of chronic diseases such as heart disease, stroke, high blood pressure, diabetes, and cancer. And there's emerging science that this may help prevent weight gain as well. With regard to the screen time, we all know this is a difficult issue, and the 2 hours or less refers to recreational screen time. So that's not associated with schoolwork. This is for non-educational purposes. And the American Academy of Pediatrics recommends less than 2 hours of recreational screen time daily for most children. We know that increased rates of increased screen time is associated with increased prevalence of overweight and obesity, and lower reading scores and more attention problems. There's a great work out by the American Academy of Pediatrics. They have a family media plan that's really gives some common sense recommendations on how to approach this issue. And they recommend no screen time or screen media if the kids are less than 2 years of age, and no screen devices in the bedroom, because we know it has a detrimental effect on the number of hours and the quality of sleep that children get. 1 refers to the 1 hour or more physical activity, and we know that's essential for weight maintenance and prevention of chronic diseases. We know that activity sharply declines during adolescence. So we know that children in their younger elementary school years are pretty active no matter what opportunity. They take advantage of every opportunity given. But older adolescents and through middle school and high school, we know that for many of those children that activity level decreases. There's good evidence that kids who grew up in active families, that active families lead to active children, and those children that grew up in active families and were active as children go on to become active adults. And finally, 0 sugary drinks. We know that obesity rates have increased exponentially, and so has the consumption of sugary beverages in our country. It's associated with overweight and obesity, displacement of milk consumption, and dental caries. I make mention on this slide of the juice consumption because we know that many children not only take sugary drinks but also consume excessive amounts of even 100% fruit juice, and so AAP does have recommendations on the amounts of juice consumption that's considered healthy. And really, water provides the best healthy alternative to sugary drinks, and so focusing on the importance of consumption of water is really important. So 5210, we know that education and the message is important, but 5210 is really more than that. It's a multi-setting approach to childhood obesity prevention. And this is an infographic from the Institute on Medicine, which came out a few years ago, and it really highlights the importance of acknowledging the work that's going on in the many settings in which we find children in our communities. So what can we do to increase opportunities for physical activity, as well as what's marketed to children, what's going on in the schools, making healthy foods available in many settings, as well as how do we embrace the role that we as healthcare providers can play. And so we know that each of us can do important work in each of these different settings, but by working together and around a common message, we can really amplify the work we're doing to make all of our work more impactful. And so what's the model that this is based on? So the national model program is called 5210 Let's Go. It's based out of Maine. They've been doing this work for over 10 years out there. And it's really done some great work and is being implemented in many states across our nation. And so their multi-setting model allows them to reach child care programs, schools, out-of-school programs, healthcare practices, and unite all of them in encouraging kids to adopt healthy habits that will really last a lifetime. So the goal of this program is to make changes in the environment and policies around children to make the healthiest choice the easiest choice. We know that knowing how to make the right choice is one thing, but actually making that choice can be a lot harder. And so this program also offers toolkits and technical assistance to change the policies and procedures in many different settings, including schools, early child care, workplace community health care, and out of school. And Maine data shows that it's working. They show improved health environments as well as increased healthy behaviors in the settings that are implementing 5210 strategies, and that they're seeing decreasing obesity rates in their state, which is really exciting because that is not in line with what we're seeing in many other places across our country. So what's the history of 5210 Healthy Choices Count here in Iowa? So it really started out as a cooperative work between United Way of Central Iowa as well as Healthiest State Initiative and Iowa Department of Public Health. Stakeholders in each of those arenas came together to identify obesity as a major issue for many Iowans, both adults and youth. Healthiest State Initiative brought together stakeholders from across our state, and really what rose to the forefront of those conversations was the need for a common message to unite the work that everyone was doing in our different silos. And United Way, this work was going on at a local level in the metro area, bringing together stakeholders. Again, what rose to the front of those conversations was, again, the need for a common message, and 5210 came to be. So all of this work was kind of going on simultaneously, and out of that work, cooperative agreements were reached, and 5210 Healthy Choices Count came to be. So the program was launched by Governor Reynolds end of last October. She announced the campaign Healthy Choices Count, and then there was an official kickoff between IDPH and United Way of Central Iowa, highlighting the work that was going on in the metro area at Carver Elementary School. And so we brought together folks to highlight the ways that 5210 can kind of come to life in one of the many different settings, such as the school setting. So they highlighted the work that was going on in classrooms with brain breaks and Pick a Better Snack, as well as the work that was going on in their schools around increasing opportunities for physical activity with a program called Kid Striders. And so Healthy Choices Count really has two big goals at this point. One, to permeate the message of 5210 to children and families' environments, as well as to provide strategies to support 5210 behaviors to a variety of people and places. And so to start out with, how do we spread the message? There are some great materials that are available at no cost that have been developed and are available at the Healthiest State Initiative website. They have brochures and posters that you can sign up and have them sent to you for free. They have newsletters, radio spots, and newspaper ads that have already been developed and are open access for anyone who has a form to get the word out that way, as well as some great social media tools as well. And there's a champion toolkit which can be downloaded to be able to be utilized by anyone in the state. So this is a screenshot of the Healthiest State Initiative webpage, and on it you'll find all of the resources that have been developed if you click on this button here. This is the list of all the different tools that have been developed, and that can be downloaded as well. And these are just screenshots of some of the different graphics that have been developed. And then if you'd like to follow on social media, please get out your phone and like the 5210 DSM Facebook page or the Pinterest site. Both of those are being populated by the Well Kids Coalition of Central Iowa, and that information is applicable to folks all over the state. There's also a Twitter handle, and Healthiest State has a Twitter handle as well. So what are the strategies that the tools that are developed are supporting? So really we're encouraging 10 strategies to help improve the environments in which kids are surrounded. Oops. So first of all, they recommend limiting unhealthy choices for snacks and celebrations and providing healthy alternatives. Secondly, eliminating or limiting sugary drinks and providing more access to water. Providing or prohibiting the use of food as a reward and providing more opportunities to get physical activity every day, and limiting recreational screen time use. Those are the big 5 components that all of us can think about where we interact with children and what can we do to change the policies and procedures in those environments to make those things more likely. Additionally, we recommend participating in national and state and local initiatives that support healthy eating and active living, such as the collaborative work that's going on here at Waverly Health Center. Encouraging community partners to support healthy eating and active living, as well as partnering and educating families in adopting and maintaining lifestyles that support healthy eating and active living. And then implementing staff wellness programs for our businesses and the families of the children in our state, as well as collaborating with food and nutrition programs to offer healthy food and beverage options. So what can you do to get involved and help support this work? So the initiative can really benefit from partnerships with leaders in local communities. Local leaders can use their position and connection to garner attention and support for the campaign and assist sectors in networking with one another. We know that we can do great work alone, but we can do much greater work together. And identifying champions to lead that positive change in each of those different environments. It really takes a few really motivated individuals, and that energy level is really contagious to be able to do great things. And so 521 champions can be anyone who's at a site on a regular basis and knows how to influence healthy eating and active living. And there are a number of tools that are now available through this program that can help support that work. And then building a team around those champions to be able to support these efforts ongoing. So where do you start? After you have your champion in place and your team assembled, there are great opportunities to find ways to assess where you're at and get ideas about what steps to take next. So in the early child care arena, the NAPSAT program, Iowa Medical Society is supporting a 5210 healthcare, and there's a site assessment as part of that work. Healthy Hometown has some great assessment tools in a variety of settings. And then Maine site itself has some assessment tools that are open for use as well. So then once you're kind of assessed and you find out where you're at, then what steps can you take next? So looking at policy changes as well as system change and environmental changes, and really thinking about what are the things that are making that choice. How can we make that healthy choice the easiest choice in all of those different arenas? And so this is a screenshot from the Healthiest State Initiative, and each of these different sectors are what currently is in place for tools to help support changes in these environments. So the child care setting, parents and caregivers, school and school-age children, and as well as healthcare settings. So if you click on the parents and caregivers, you can see the list of the different resources. So if you click on each of these little boxes here, it'll be a drop-down menu of one-page informational handouts on a variety of topics underneath each of these. So some great one-pagers. They all have the 5210 logo on it, and the idea is that kids will see these logos across your community. So they'll see them in the schools and in the healthcare settings, as well as in their community at large, as well as the parents will understand what that means. And so we know the more times people see a message, the more likely it is that they'll act on that. So check out this page and see if there's some resources that might be helpful for you. The great thing about the 5210 Let's Go program is that all of the materials that they've developed and had 10 years of experience behind, they make available for other states to use as well. We can adapt them with our logo and put them on our website and spread the word. So they're really giving in their approach to this topic. This is just a screenshot of one of the handouts that we talked about with some ideas about fruits and vegetables and how do we tips for consumption of those all year round. And so what are some ideas about things that we can do? As far as the 5, if we're going to focus on that, maybe creating healthy snacks and celebration policies at schools, conducting taste tests to try new foods, my daughter, there's a great program through 4-H. There's a race across the state, and they've engaged 4-H clubs on how do we make changes in our 4-H meetings to make things healthier. And so one of the things they needed to do was to offer a healthy fruit or vegetable at each of their meetings, and they did that by incorporating taste tests. So each meeting they try a new vegetable and they get to put a sticker on a chart, and kids really like it and they try new foods. So there's some really easy, fun ways for kids and families to get involved in that way. As far as the 2 policies to support screen-free environments and screen-free times, so what's the screen-free policy at lunchtime in the schools? Are school kids able to use their screens during lunchtime, or is that not allowed? And thinking through what is the best choice for those schools. Having ideas about a board game section at the library to incorporate other alternatives to the screen times. Participating in National Screen-Free Week and having some publicity around making some healthier choices on those weeks. Around the 1, some schools and communities have instituted walking school buses to make active transit to school more likely and possible for kids in their communities. Sometimes having increasing signs on trails will make it more likely for people to utilize those. And then around 0, changing policies in schools to allow or provide water bottles during schools. That's an easy policy that a lot of schools are getting on board with. We know that that decreases constipation and headaches for kids as well, so that's a great win-win situation. And there's a great movement to install water bottle filling stations as well, with some funding from Delta Dental. So great ideas that people can choose from. And then I'll tell you a little bit about the work that's going on in the healthcare setting. So in the last year, this program has gotten underway in central Iowa and has quickly spread to sites across the state with some support from United Way as well as Iowa Medical Society and Cole's All Kids Healthy. You can see that there's a number of sites across the state that clinics have committed to 3 goals. So clinics that are 5210 healthcare registered sites can commit to connecting to the community by displaying posters on the 5210 in their waiting rooms and exam rooms. So they're connecting with this work that's going on in the community by displaying that same poster in their waiting rooms and exam rooms. Accurately weighing and measuring patients, and that's done by most healthcare providers on a regular basis, and calculating and recording BMIs, and that's our EMRs are doing that for us now, which is great. There's some tips and tricks to make this easier that is available on a webinar online as well. And then finally having a respectful conversation around healthy eating and active living at every kid's well child visit between the ages of 2 and 8. And there's some great tools to be able to make this more efficient and effective. It's a free program. Clinics just fill out an annual survey, and if clinics are successful in implementing all 3 goals, they're recognized as the 5210 healthcare cited distinction. This is some great resources. So if you're looking for free CME or CEU credits, there's these recorded webinars. So there's 6 hours of recorded webinars that can be accessed and viewed and for CME or CEU credits. So if you're looking for information about how to accurately weigh and measure patients, weight-based bias and stigma, motivational interviewing or brief action planning, overview of childhood obesity, or how do you implement stage 1 and stage 2 in your primary care setting, that's all available there. As well as some tools for providers as well. This is just how to get to the website on the Iowa Medical Society webpage. As far as healthcare setting as well, they've got some fact sheets that can be given out to patients at their visits, as well as links on how to order posters for your room or how to get your site registered to become a 5210 healthcare site. The trainings, there's a link to the training site, and as well as some clinics are having 5210 t-shirt days where they can promote the message by wearing t-shirts. And if they're interested in downloading that Champion Toolkit I talked about earlier, that's on this website too. So this is at the Healthiest State Initiative. If you just Google 5210 Iowa, that's what's going to pop up. You go to the healthcare component of that website and it'll take you right to this page. Those are the t-shirts that are available, and those are the posters, and these are the questionnaires that are being utilized in those clinics. These are the free CME and CEU that I mentioned earlier. And then finally, I'll just give you a few other resources that are available statewide and have been utilized by many of the 5210 healthcare sites. There's some great nutritional videos that were produced by the Iowa chapter of the Academy of Pediatrics, as well as first 5. And so these are great for patient education. If you've got scrolling video in your waiting rooms, or if you want to post it to social media, check those out. Hy-Vee is doing some great work on Kids Fit programming, getting kids and communities excited about fitness. And they've done a 5-week challenge that there's a booklet that can be downloaded. Some local Hy-Vees are printing those, and it takes kids through a series of challenges, and so it's a great thing heading into summer. We know that some kids actually get less active in the summer than they are in the winter because they're indoors more and maybe home by themselves, and so this gives a framework for some of those kids to be more active if families want to engage together in that. These are some of the screenshots of the booklet, and they do unite around the 5-2-1-0 message as well, so it goes in nicely with some of the other educational material that's being put out. There's a program called Buy, Eat, Live Healthy. That's a 9-week program. We know that it's important for us as healthcare providers to connect with patients in our offices, but really the number of contact hours is related with the number of how successful patients are. So if we can connect them to resources in their communities to get more education, they're more likely to be successful. There's a Spend Smart, Eat Smart app as well that has some great information. This is through Iowa State Extension. And then the Dr. Young project has some innovative ways to get kids excited about cooking as well. So that's all the information I have. I'll take any questions you have, but thanks for your interest in this topic. Don't hesitate to contact me about any of those methods if I can be of any assistance.